We know that so many of you have questions about the coronavirus. It's uncharted territory for all of us. So we asked the Chief Clinical Officer at Hartford Healthcare to answer 3 questions you've been asking. First today, if people are symptomatic, can they transfer it?
That's a real concern. A lot of patients actually a lot of young individuals are going to have this disease, which is going to be asymptomatic. And so I would not know if I were exposed to this virus. I may not display any symptoms, but I could easily pass somebody who's sitting next to me who has a higher risk, as I described earlier on, and pass the disease.
So
Question 2, if someone ends up with a breathing aid, does the virus run its course and do the lungs rejuvenate?
Generally, there is a supportive treatment. It depends on the underlying capability or the underlying medical conditions the patient has. What we do is we provide supportive care, the oxygen therapy and supportive care with the ventilation help and other things. Generally, the people who recover, they recover completely, and there's no remnant effect as best we know. But again, I want to remind the viewers, it's a early stages of learning we are in at this time, so we don't know the long-term effect of this, what that would look like.
Now, finally tonight, many of you have been asking, why is it important that these containment measures exist?
The containment effort are really important because our primary measure to stop the spread of the disease is to reduce the contact or the spread of the disease. So the large gatherings, large meetings, or travels and things like that, where it's easy for people to get exposed.
changed?
Our talk with Channel 3's Kara Sundland for nearly an hour this week, fielding so many questions. You can watch the full interview in the special coronavirus section on the all-new Channel 3 app.